Hi, this video is to show how to flush a open-ended PICC line. As you can see, here we have an open-ended PICC line. You can tell that it's open-ended because it does have clamps on each lumen, which are the blue pieces here. And they open and close, and they should stay closed when not in use. And so they are closed. And we're going to flush the PICC line. What we're going to need is a 10 cc pre-filled syringe of normal saline, 2 of them, 1 for each lumen. And because it is an open-ended PICC line, we're also going to need to have already pulled up some heparin. So here I have 2 10 cc syringes with hepaline, 100 units per mil heparin solution, and per protocol I do have 3 mils per lumen. Okay. So first thing I'm going to do is my hand hygiene. Position my patient. And I'm going to put on clean gloves. We are going to also need 2 SoluPrep swabs, 1 for each lumen. Actually, we're going to need 4 because we're going to need 1 for each lumen in between heparin and saline as well. So I'm just going to grab 2 more. Okay. And I have 2 more. So we're going to open our 10 cc pre-filled saline. And we're going to get the air out so that we don't risk putting any air into the patient. Okay. And I'll get both of those out and ready. There we go. It doesn't matter which lumen you flush first, so you're going to pick a lumen. And you're going to wrap your swab around it, and you're going to you're going to swab it for 15 seconds. And we will pretend that 15 seconds is there. And you're going to take your pre-filled syringe, and you're going to push it in and turn clockwise. Then you may open your clamp. And you're going to pull back slightly so that you can see blood in the right here in the lumen. Okay, so we're going to pull back slightly, and there's our blood. So we're going to stop there. We're going to flip our syringe up in case we have any air, and that air will sit at the plunger instead of going into the patient. And we are going to pulse pressure flush. So I'm pulsing, and I'm giving the entire 10 cc's of saline to flush this lumen. And I do have an air bubble because I'm dealing with the fake PICC line here. So I will stop right about there. And as I push on the plunger with my thumb, I'm going to close the clamp down here with my thumb. So 1, 2, 3. And I'm going to leave it hooked up so that I will remember that I have flushed that one. And I'm going to take a new swab, and I'm going to wrap it around my other lumen. And I'm going to scrub the hub for 15 seconds. And we will say that is 15 seconds there. We're going to take our next pre-filled syringe, and we're going to connect it, push and twist clockwise. Now we can open the clamp. And we're going to pull back slightly and hope that we see blood, and we do. So then that verifies placement, so we are able to flush it. And we are going to flip it up again, make sure that there's no air going into the patient, and pulse pressure flush. Now, if you are unable to pull back and aspirate and get blood, I did talk about the troubleshooting techniques in the other video of closed-ended PICC lines. So you put the arm at 90 degrees, you put the patient's head of the bed flat, you have the patient cough, or you change the caps. But certainly if you get blood return in one lumen, then that tells you that placement has been verified and you don't have to worry if you don't get blood in the second lumen. Okay, and I'm going to push my plunger and my clamp closed at the same time. Okay, and I'm going to leave it connected as well. Now it's time for my heparin that I've drawn up. Make sure that I have no air in my syringe, and again I'm using a 10 cc syringe because we are dealing with a PICC line. Anything less, the PSI is too high and you can blow a hole in your PICC line. I'm going to take a swab and I'm going to make sure my clamp is closed. I'm going to take my old saline flush off. I'm going to swab again for 15 seconds. We'll pretend 15 seconds is up there. I'm going to take the needle off of my heparin. I'm going to push and twist. Now we do not want to pull back for blood. We've verified placement. We've flushed it, so we've pushed all that blood through. We wouldn't want to pull back and have blood again in the catheter. So the reason that we flushed it was to get rid of all the blood and push it in to the patient so it's not sitting in the line and backing up and causing potential blood clots. And the reason that we need to use heparin with an open-ended PICC line is because there is not a one-way valve inside the PICC line that prevents backflow of blood and prevents clot formation. So we're going to put the heparin in the line to hopefully prevent clot formation. So now we'll hold it up. In case there's any air, we'll open our clamp. And we will simply pulse pressure flush. Okay, and right before the end, I'm going to again push the plunger and push the clamp closed. I'm going to leave that hooked up, and I will know that I've flushed that one with heparin. And now I am ready to do the second one. Again, I'm going to take off make sure my clamp is closed, and it is. Take off the old 10 cc flush, swab it for 15 seconds. We'll pretend 15 seconds is there, and I'm going to connect my heparin, push and twist. And again, I don't want to pull back for blood. I've already done that. I've already flushed it, so I'm going to open my clamp, and I'm simply going to pulse pressure flush the 3 cc's of hepaline. And at the end, I will close the clamp and I will close the plunger, push the plunger. Now I'm all done, so I can take that one off, I can take that one off, and I have flushed my open-ended PICC line. And that's all there is to it. If you have any questions, please contact me. Thank you.